Now to an important discussion that not enough of us are having with our loved ones. It's a conversation about making our wishes known at the end of life to those who are close to us. Recently, physicians, nurses, and advanced practice providers at Cadlick learned from one of the nation's foremost authorities on what's called advanced care planning.
The fact is that despite all of the advances in modern medicine that we rightfully celebrate and use aggressively, we have yet to make even one person immortal. So if we're going to really commit to the best care through the entirety of human life, we have to get this part of it right too.
Dr. Ira is the Chief Medical Officer of the Providence Institute for Human Caring. He has devoted his professional life as a physician to the incredibly important part of medicine called palliative or end-of-life care.
These days when I teach young medical students, I emphasize that in addition to asking patients, what's the matter with you, first and foremost we should ask, what matters most to you? Because illness and health is personal. It's only partly medical.
On this day, Dr. Byock is in the Tri-Cities, meeting with providers from Cadlick and Providence St. Mary Medical Center.
This is a new problem. People in yesteryear never had these problems because we died quickly of things now that we thankfully live with for many years. And so quality of life has entered the equation of what the best treatments are for a given individual, for their personal well-being.
Make no mistake, having these conversations is not easy, but Dr. Byock says they are vitally important. In his own case, he's motivated toward having advanced directives for the most personal of reasons.
My message today is that this is just good, healthy adult behaviors for the 21st century. I have an advanced directive, not because I have a diagnosis, and not because I'm a doctor, but because I'm a dad. And I know that if I'm in a car accident or have a bad stroke or heart attack, my wife and my children are going to wrestle with decisions about what's best for me. I can't stop that. I wouldn't even want to stop that. Who knows me better than them? But what I can do is clarify without any doubt that they have authority to speak for me. First my wife and then my two daughters. And I can tell them what I think I would probably want in those circumstances, not to tie their hands, but to lift a little bit of the burden from their shoulders so that they're making decisions consistent with what they know I want, my values, preferences, and priorities.
The movement toward whole person care, as Dr. Byock calls it, is evolving. He envisions the day when these difficult conversations are occurring regularly among loved ones, with loved ones, for the benefit of loved ones.
This is not about giving up hope. Frankly, if we hope that we're going to live forever, that's just superstition. That's not, that's not reality-based. We can hope to live as fully, as lovingly, and joyfully as possible, and that includes going through these difficult times together. If you don't talk about these issues, you actually separate yourself and the person who's seriously ill. Just going through this as a family, as good friends, as people who love one another. The wisdom I've learned over 35 years of practice is the best way to go through these times is together.
If you'd like to learn more or access some online resources, visit providence.org/institute for human caring.